Okay, my name is Bree. I'm going to be your student nurse for the day. Can I just check your ID band? Just say your name and date of birth for me.
Kristen Kapinski, June 13th, 1974.
Perfect. I just want to let you know that anything that you will say, like we'll just go through a bunch of random questions today, and anything that you say will be confidential and kept between me and you. And are you comfortable today?
Yes.
Okay, and is there anything I can get for you before we start?
Not right now.
Okay, and I washed my hands and I went into the patient's room. Okay, and then your name for these, your name.
Kristen Kapinski.
Perfect, and then you're female. And then what is your date of birth again?
June 13th, 1974.
Wonderful, and are you married?
Yes.
Okay.
Happily.
And then what is your primary language?
English.
And then do you write and read that also?
Yes.
And do you have a second language?
I do not.
Okay. And then what is your educational level?
Bachelor's degree.
Bachelor's degree. And then what did you get that in? What was it in?
It was in marketing.
Marketing. And then are you employed?
I am not employed. Stay-at-home mom.
And then who lives with you?
I have 4 boys and my husband.
Perfect. And then do you have like a support people for you and anybody that takes care of you?
Well, I don't need care, but I do have a good group of support of friends.
Yeah.
and a good network around. Yes.
Awesome. And then what are you here for? Like what brought you in today?
Yes, I have an ache in my hip.
That's not very good. And are you comfortable with seeking care from this organization?
Of course.
Perfect. And have you had past positive experiences?
Absolutely.
Okay. So, what does the pain feel like?
It's more when I stretch or when I stand up and try to walk a little bit. It's like a stabbing pain in my left hip.
Okay. And when did it start?
Oh, probably a year and a half ago. Time to get it looked at.
And then where does it start at? Is there a specific area that you feel it, or is it the whole hip?
It is the entire hip.
And then does it radiate, or is it just pretty?
It does not radiate.
Okay.
It's just more of a stab.
And does it go away, or?
It only hurts when I'm using that particular muscle or joint. So when I'm sitting, it does not hurt.
Yeah. And then on a scale of 0 to 10, 0 being no pain, 10 being like the worst pain ever, what would you rate the pain when it happens?
When it happens, it's probably about a 6 or 7.
And then what's a tolerable level of pain on that scale for you?
That's a good question. Tolerable would probably be a 4 or 5,
4?
I guess.
And then does anything make it better or worse?
Nothing makes it better when the pain is there, other than sitting back down.
Yeah.
What makes it worse is stretching.
Okay. And then do you have any other symptoms with it, as in like muscle soreness like in your legs or cramping or anything?
No other pain. I have full mobility and everything.
Good. And then how does this like have an effect on your daily life between like getting dressed, working out, going to like making food, things like that?
I can do all that. It just the initial pain of like standing up hurts. It doesn't stop me or prevent me from doing anything. It's just a pain level.
Yeah. And then so we're just gonna go into like your past medical and surgical history. Did you have any problems when you were born, like any medical problems?
I did. I had pyloric stenosis.
Okay.
And I had surgery to remedy that at just a couple weeks old.
Okay. Okay, and then did you have any illnesses when you were a child?
No.
Okay. And then have you had any like acute adult illnesses, like either physical, emotional, or mental, like that you are being treated for?
None at all.
Okay. And do you have any chronic adult illnesses?
I don't have any. No.
Okay. And then have you had any accidents or injuries recently?
No. Other than my hip hurting, I haven't had any accidents or injuries.
And then how many pregnancies have you had?
I have had 5 pregnancies.
Okay. And how many live births?
4.
And then how many miscarriages?
Just the 1.
And then no abortions?
No.
And then we're just gonna go to your immunizations. I have a list of like all the ones that you're supposed to have based on your age. So you're supposed to have the flu vaccine, which is done every year, the Tdap, which is done for like each of the pregnancies, your MMR, your varicella, your HPV, pneumococcal, Hep B and Hep A, meningococcal ACWY, meningococcal B, and then HIB. Do you want to read your immunizations and see which ones you have and then when you got them, if possible?
So, let's see.
You can just read them down the list.
The hepatitis B was, so the last time was March 13th of 2013. What are the other ones? I think it looked like I got,
Tdap.
yep, I got all that on March 13th, 2013 is when the last time I got all of those updated.
Okay. Would that be like your varicella, Tdap,
Absolutely.
HPV, pneumococcal?
Yes.
And then have you gotten Hep A at all?
Yes, I did.
Oh yeah.
I got that one as well.
Okay, perfect. And then your meningitis B and HIB?
Yes.
Okay. And then are you taking any medications right now, either prescribed, herbal, or over the counter?
Only once in a while for discomfort, I'll take some ibuprofen.
Okay. And then do you have any allergies to medications?
None to medications.
Foods?
No.
Contact substances?
No.
Something like latex. Environmental substances?
Would that be like pollen and stuff?
Yeah.
Yes, I do have seasonal allergies.
And then what would that, what is your like reaction and treatment?
So reaction would be stuffiness, runny nose, or runny eyes, and I usually take an antihistamine.
Oh,
for
perfect.
that.
And then I'm just going to go through each of your body systems, ask you a couple questions on each one. You can just answer yes or no, or if you've had any of the symptoms recently. We'll start off with your skin, hair, and nails. Have you had any skin discoloration, abnormal temperature, dryness, excessive sweating, rashes, lesions, balding, dandruff, or abnormality of the nails?
I haven't.
And then with your head and neck, have you had any headaches recently, swelling in the neck, stiffness of the neck, difficulty swallowing, enlarged cervical lymph nodes, anything like that?
I have not.
Okay, and with your eyes, have you had any vision changes, eye infections, redness, excessive tearing, excessive dryness, halos around lights, blurring, loss of side vision, moving black spots and specks in visual fields, flashing lights, double vision, or eye pain?
That's a lot, but nope, I haven't had any of that.
Okay. And then for your ears, have you had any hearing loss, ringing or buzzing, earaches, drainage from ears, dizziness, exposure to loud noises?
No.
No, okay. And then for your mouth, throat, nose, and sinuses, do you have any like conditions of your teeth or gums? There's sore throat, mouth lesions, hoarseness, rhinorrhea, nasal obstruction, frequent cold, sneezing or itching of eyes, ears, nose, and throat, and then nosebleeds or snoring?
No.
No, okay. And then, sorry, there's a couple more sections here. For your thorax and lungs, so it's your chest, do you have any difficulty breathing, wheezing, any pain, shortness of breath during routine activity, cough, sputum production, hemoptysis, which is throwing up blood, or respiratory infections or coughing up blood?
No, praise God.
Yay. And then for your breast and regional lymphatics, any breast lumps, dimpling of skin, changes in breast size, swollen or tender lymph nodes in the axilla, which is your armpit, and then any nipple discharge?
No, I don't have any of that.
Okay. And your heart and neck, do you know what your last blood pressure was? Was it normal?
It was a normal one,
Okay.
yes.
And then your last EKG result, have you ever had one of those?
I don't recall ever having one.
Okay. And then do you have any chest pain or pressure or palpitations?
No.
Okay. And then for your peripheral vascular, which is just like your extremities, do you have any swelling of the legs and feet, any pain, cramping, sores on legs, any color, or texture changes on your legs?
None.
Perfect. And for your abdomen, do you have any indigestion, nausea, vomiting, abdominal pain, diarrhea, constipation, pain, with pooping, hemorrhoids, gas, belching, jaundice, or hernias?
Only after eating ice cream, but no, none at all.
And then do you have any like recent changes of your bowel habits?
I haven't.
Okay. And then do you, for your female genitalia, when was the last time you had a menstrual cycle?
My first day was February 12th.
Okay. And then do you have a regular menstrual cycle?
Yes.
And then how long do they last?
5 days.
Perfect. And then, do you have any breakthrough bleeding, use of contraceptives, pelvic pain, vaginal discharge, urinary urgency, urinary frequency, or urinary incontinence?
No.
Okay. And then for your musculoskeletal, any swelling, redness, pain, or stiffness of joints?
Nope.
And then the ability to independently perform activities of daily living or muscle weakness?
Well, I'm fine.
Okay. And then for your neurological, do you have any feelings of sadness, anxiousness, anger, headaches, loss of strength or sensation, difficulty with balance, difficulty with coordination, difficulty speaking, memory problems, strange thoughts, interactions, or difficulty learning?
Not at all.
Wonderful. Okay. And then, please can you just tell me on average, like what a typical day is for you? Like start with like getting up in the morning and then like continue through bedtime.
Are you wanting to know times or just what I do?
Just what you do, and it's
okay.
pretty detailed.
Yeah, so usually get up and get breakfast going for myself and the kids and get them off to school. Usually have to take one to school, and then I come home and exercise and do housework and plan meals, usually run errands or meet with a friend for coffee or something. Just try to anyway, yeah, that's kind of my day. And then evening is picking up kids and helping with homework and doing nighttime dinner and activities with them.
Perfect. And then what do you usually eat during a typical day?
I try to eat lots of soups or salads. So I usually don't eat breakfast for myself. I have my coffee in the morning. And then something nutritious for lunch, and then for dinner we usually have like a meat and vegetable option for everybody.
And then how often do you eat throughout the day?
How often do I eat? Well, I don't usually start eating till lunchtime, and then I eat every couple hours through dinner.
And then what foods are some foods that you prefer to eat? So you had said soups and salads.
Mm-hmm. Definitely those. I love fruit and smoothies as well.
Okay. And then do you eat out at restaurants frequently?
I do love to do that.
And do you eat only when you're hungry, or do you eat because of like boredom, habit, anxiety, depression, anything like that?
Yes, I have definitely eaten out of bad habits. Yes.
For sure. And then who buys and prepares the food you eat? Do you have a sufficient income for the food?
Yes, my husband works full time, and he provides financially, and I do all the shopping and cooking.
And then where do you eat your meals? Do you dine alone or with others?
Definitely with others.
Okay. And how much and what types of like fluids do you drink?
Oh, well, I try to drink a gallon of water a day, plus my coffee.
There you go. And then do you believe that exercise is important to health? And
Absolutely.
How much do you exercise each day?
So I exercise 5 to 6 days a week and 45 minutes to 60 minutes a day.
Nice. And what is your daily pattern of activity like when it comes to exercise? We have a stationary bike in the basement, and so I usually will ride about 15 miles a day on that, and then do some weight activity. Nice. And then are there any reasons why you cannot follow a moderately strenuous exercise program?
No.
Okay. And then do you follow an exercise plan?
No.
What do you do for leisure and recreation?
Watch the kids do all of their activities, plus I like to bike a lot and walk outside.
And then you just mentioned that you like to bike and walk, so that would be that your leisure activities do include exercise.
Definitely.
So we're gonna go into sleep and rest. Do you have any sleeping patterns that you notice?
I think I try to go to bed at the same time, about 10:30 every night, and then wake up around 6:30 each morning.
Do you ever have trouble falling asleep or staying asleep?
Falling asleep, definitely not. Staying asleep, yes. If I'm awakened in the middle of the night, it's hard to go back to sleep.
And do you feel rested when you awaken?
No.
Do you nap during the day, and how often and for how long if you do?
I do not nap.
And then what do you do to help you fall asleep?
Turn the lights off. I'm ready for bed. I'm ready for bed then.
Okay. How much beer, wine, or other alcohol do you drink on average?
Maybe one glass of wine every 2 weeks.
And then do you drink coffee or other beverages containing caffeine? If so, how much and how often?
I drink about 15 ounces of coffee a day.
And then do you know or have you ever smoked cigarettes or used any other form of nicotine?
No.
Okay. Have you ever taken any medication not prescribed by your healthcare provider? If so, when, what type, and how much and why?
The only thing that I have taken is vitamins
Like
and then just
supplements.
ibuprofen.
Yeah. Have you ever used or do you now use recreational drugs?
I do not.
And then do you take vitamins or herbal supplements? If so, what kind?
Oh, yeah. So I take magnesium and vitamin C and zinc.
Okay. And then what do you see as your talents or special abilities?
My special abilities. I don't know. I guess it's just being a mom to 4 boys is kind of a lot. But I don't know. I like to just be with friends and do Bible studies and explore that kind of thing.
And then how do you feel about yourself, about your appearance?
I'm comfortable.
And then can you tell me what activities you do to keep yourself safe, healthy, and to prevent disease?
Well, I try to exercise regularly and eat healthy and go to the doctor as needed to be able to get breast exams and that kind of thing done.
And do you practice safe sex?
Yes.
How do you keep your home safe?
I mean, we don't have any kind of security, but we do lock the windows and the doors at night, and I don't know what other things that I would do, but
Do you drive safely?
yes.
And how often do you have medical checkups or screenings?
As recommended, usually yearly.
How often do you see the dentist or your eyes, or have your eyes examined?
Eyes are once a year, and dentist is twice a year.
Perfect. And then what do you do for fun and relaxation?
Fun and relaxation is probably the same as activity, which would be biking and walking and reading books.
And then are you involved in any community activities?
I am.
And then with whom do you socialize most frequently?
I have several groups of friends that we get together with on a weekly basis to be able to talk.
How do you feel about your community?
So the close-knit community I love.
And do you think that you have enough time to socialize?
Absolutely.
What do you see as your contribution to society?
Just volunteering.
Yeah. And then relationships is our next category. Who is or are the most important people in your life? And then describe your relationship with that person.
Okay, well, my husband is the most important, and we try to go on a walk or go for a drive most days just to have some alone time to talk. And then my kids are the next important, and try to just keep up with them.
Yeah. What was it like growing up in your family?
Loving family, caring family, laughed a lot, and went on vacations together.
And then what is your relationship like with your spouse?
Oh, very close.
And then same with your children?
Same, yes.
Okay. And then describe any relationships you have with significant others.
Like people who are important to me?
I think
with
just with your husband.
describe the relationship?
Yeah.
Well, we're very open and comfortable with each other, and we try to get a lot of alone time together.
And then do you get along with your in-laws?
Yes.
Are you close to your extended family?
Very close.
Do you have any pets?
I do have a dog.
And what is your role in your family? Is it an important role?
I believe so.
And then are you satisfied with your current sexual relationships? Have there been any recent changes?
There has not. We've been married for over 25 years and very happy.
We'll go to values and belief system. What is most important to you in life?
It's my relationship with God and the relationship with my family.
Okay, and what do you hope to accomplish in your life?
Oh, to leave a legacy, to be able to let the kids know what's important.
Yeah. And do you have a religious affiliation? Is that important to you?
Yes, and it is a priority.
Okay. And is a relationship with God an important part of your life?
Absolutely.
And what gives you strength and hope?
Jesus.
Okay, and then we'll jump down to education and work. Tell me about your experiences in school or about your education.
Okay, well, I went to a 4-year college, so that was super neat to live away from home and be able to grow up and become mature in that way and be able to learn how to be independent and use that education to be able to further my career and then my passions.
And then, are you satisfied with the level of education you have, or do you have plans to go back to school?
Oh, I'm very satisfied.
What can you tell me about your work? What are your responsibilities at work?
I don't work outside the home, so I keep my responsibilities to forming relationships and keeping the house running.
Yeah. And do you enjoy that?
I love it.
Okay. And then, do you have any stress that's related to being a stay-at-home mom?
I mean, there's always stress of just too much to do and not enough time.
Fair. And then, who's the main provider of financial support in your family?
My husband.
And does your current income meet your needs?
Yes.
Okay. And then, what types of things make you angry?
Oh, people who are crabby and don't treat others nice.
How would you describe your stress level?
Oh, right now it's fine. It just depends on the day, but
That's
yes.
How do you manage anger or stress?
Well, I stay off social media, so that's one way, is to not get drawn into it.
Yeah.
And exercise.
Okay. And then what do you see as the greatest stressors in your life?
Greatest stressors. Change.
That's fair.
Not being able to control change.
Yeah. Where do you usually turn for help in a time of crisis?
My husband.
And then what risks are you aware of in your home environment, such as your home, neighborhood, or the job, or any other activities in which you participate?
Risks?
Or are there any?
I can't think of any risks. I feel like we kind of build ourselves around safety, but there are, again, a lot of things, obstacles that we can't change.
Yeah. And then what types of precautions do you take, if any, when playing contact sports, using harsh chemicals or paint, or operating machinery?
I mean, the only thing I could think of is our pool, is that maybe, we just follow the rules to be able to keep the chlorine levels correct and all the chemicals that go in that, and to be able to keep it safe so kids especially are safe in and around a pool.
Yeah. And do you believe you are ever in danger of becoming a victim of violence?
No.
Do you participate in religious activities?
Absolutely.
Do your beliefs and practices provide strength and comfort?
Yes.
And are they essential to your well-being?
Yes.
Do you have beliefs that would conflict with treatments or procedures that we would do?
No.
Is your diet restricted in any way by your religious or cultural beliefs?
No.
Are there foods that you believe help to make you healthy or ill?
I do believe that fruits and vegetables make me feel better.
Oh, yeah. And then we're just going to go through, like, Erickson's psychosocial development and kind of just go through that.
Okay.
I'll just ask you a bunch of questions for that. Do you accept yourself physically, cognitively, and emotionally?
I do.
Do you have independence from your parental home?
Yes.
And then do you express love responsibly, emotionally, and sexually?
I think so.
Do you have a close or intimate relationship with a partner?
Yes.
Okay. And do you have a social group of friends?
Absolutely.
Do you have a philosophy of living in life?
Integrity.
Okay.
Yes.
And do you have a profession or a life's work that provides a means of contribution?
Well, yes, being a mother and then volunteering in the community.
Yeah. And do you solve problems of life that accompany independence from the parental home?
Yes.
So I would say she mastered that stage. Oh, shoot, I did the wrong one. And then the middle-aged adult one, do you have healthy life patterns?
I do.
Do you derive satisfaction from contributing to growth and development of others?
Yes.
Do you have an abiding intimacy and long-term relationship with a partner?
I do.
Do you maintain a stable home?
Yes.
Do you find pleasure in an established work or profession?
Yes.
And then do you take pride in self and family accomplishments and contributions?
Yes, I do.
And do you contribute to the community to support its growth and development?
I do try to be a contributing member of the community, yes.
Awesome. I'd say you'd mastered that one also. And then that is all the questions that I have for you today.
Okay.
Thank you so much for doing this interview.
You're welcome.